The educational materials presented here were developed by students and faculty of the Department of Food Science and Human Nutrition at Iowa State University. Funding for this project was provided by grants from the American Cancer Society Midwest and the Lance Armstrong Foundation. The materials are intended for educational use and are not meant to provide medical advice. We welcome your feedback about these materials. Please use the evaluation survey link on the homepage to provide your comments and suggestions.
If you can remember back to your first few years in elementary school, think about your favorite subject. Maybe you really enjoyed your math class and had parents that would congratulate you on your 100% gold-starred math homework. On the other hand, maybe you were not so good at math but loved art class and had parents that would always make sure to ask about all of your latest creations in school. Or maybe your favorite subject was reading or music. Well, I want to talk to you about my favorite subject, the lunch period. Parents should be talking to their kids about what they choose to eat at school in the same way parents ask their kids about how they're doing in math class. Education is now more than the 3 R's. So let's start the discussion by talking openly about the facts of school nutrition. Now, this is important information for anyone who's a parent, a grandparent, a future parent, anyone who is a babysitter, anyone in the healthcare profession, anyone in a profession associated with a school, and any community member in general. I'm sure it's no surprise that obesity is on the rise for both adults and children in our nation. This chart shows the obesity trend in both girls and boys ages 6 to 11 and ages 12 to 19. The first column is showing data from 1963 to 1970, when less than 5% of children were overweight or obese. The last column is showing data from 2003 to 2004. By this time, between 15 and 20% of children were overweight or obese. I have even read that the number is now up to 32% of children between the ages of 2 and 19 that are overweight or obese. 1 in 2 children between the ages of 6 and 19 in the United States is overweight or at risk of overweight. Data strongly suggests that obese children are more likely to develop adverse health outcomes, including diabetes, hypertension, and even a shortened lifespan. Weight loss attempts in adulthood are very difficult and have limited success, so it is very important and urgent to address and reverse the obesity epidemic in childhood. Addressing the problem before it begins in childhood is a major public health strategy. Take a look at the data on this next slide to see why early prevention is key. The fact that 1 in 2 children are overweight or are at risk of becoming overweight is alarming. The fact that 32% of children are overweight or obese is equally as alarming. But knowing that these overweight children are very likely to become obese adults adds another level to the problem. The risk of adult obesity at every age interval is significantly greater if the child is overweight and if the child has a parent that is obese. Looking at the table, you can see that 1 to 2-year-olds with no obese parents only had an 8% chance of becoming obese in adulthood. But an overweight 10 to 14-year-old with obese parents had a 79% chance of becoming obese in adulthood. This cycle clearly needs to be stopped before it starts. Yes, something drastic needs to be done, but not just because of the rise of obesity. You may be thinking, well, my child isn't overweight. But weight is not the only measure of health. It is important for both normal weight and overweight children to get the recommended nutrients. And the fact of the matter is that most children are not meeting all of the recommendations. Only 2% of kids meet all food guide pyramid recommendations. 16% do not meet any, 40% meet only one, and more than 84% of kids eat too much fat, while 91% of children eat too much saturated fat. Less than 15% of children get enough fruits, less than 20% get enough vegetables, and less than 30% get enough milk. Can you guess what our children do get enough of? While fruit, vegetable, and milk recommendations are frequently far from being met, Soft drink consumption is soaring. Looking at this data, you can see that soft drinks make up a fair share of total calories each day for many children of all ages. Not only are children being fed too much pop, but the majority of their snacks come from cookies, desserts, potato chips, salty snacks, and candy. 16% of snacks are fruits, but only 1% of snacks are veggies. It shouldn't be surprising that most children eat only half the recommended 5 daily servings of fruits and vegetables. Plus, the vegetables that they are eating are not the highest in nutrient quality. The most common vegetables eaten by children are French fries, ketchup, and pizza sauce. Children have especially low intakes of nutrient-rich, dark green, leafy, and deep yellow veggies. As you can see, this is an overview of how to read my pyramid. Locate the moderation description in the middle of the left side. It explains that moderation is represented on the pyramid by narrowing of each food group from the bottom to top. The wider base stands for foods with little or no solid fats or added sugars. These should be selected more often. The narrower top area stands for foods containing more added sugar and solid fats. These should be selected less often. For example, brown rice would be at the base of the grain group, while a donut would be at the tip. For the vegetable group, spinach would be at the base, while French fries would be towards the top. For the fruits, an apple would be at the base, while a slice of apple pie would be at the tip, or skim milk versus ice cream, or fried fish versus baked fish. This is what I was referring to when I mentioned that while kids may be consuming foods in all of the food groups, they are not always choosing the most nutritious foods in each group. The previous slides made it sound like many children have upside-down pyramids. So I wondered how schools were doing with providing kids with a variety of foods from each food group. And I wondered if schools were choosing to serve mostly the foods in each food group that were nutrient-dense with little added fat and sugar. Let's take a look. I checked the menu for the school I attended in elementary and high school. I do want to point out that my school is a very small school in Iowa, and I am sure that menus differ greatly depending on the school district and across the country. But on the day I checked, my school in Northeast Iowa was serving cereal, milk, juice, and a muffin for breakfast. For lunch, they were serving scalloped potatoes and ham, peas, mandarin oranges, a cookie, milk, bread and butter, and a salad bar was available for the high school students. Now this menu doesn't give us a lot of information, but let's do some estimations to see how it contributes to a child's diet based on the My Pyramid guidelines. This would be a great activity for parents to do with their younger children, or teachers to do with students to increase the communication about nutrition of the foods the child chooses to eat. This is what was offered to children on the menu for the day I looked at, my former school. A child at this school would choose items from each of the breakfast options and some from the lunch options, while also being offered 40 minutes of physical activity during the school day. In order to estimate a child's approximate nutrient intake, next we're going to take each food choice that we had for breakfast and lunch and put them into the appropriate food group. Next, you would need to estimate the serving sizes. For example, perhaps for breakfast a child ate 1 cup of whole grain cereal, which is within the grain group, 1 cup of milk within the milk group, 1 small muffin within the grain group, and half a cup of orange juice within the fruit group. For lunch, the child had about 1 cup of scalloped potatoes within the vegetable group, 2 ounces of ham within the meat group, half a cup of green peas within the vegetable group, half a cup of mandarin oranges within the fruit group, 1 cookie, which if it were made with oatmeal, and we are generous, would go in the grain group, 1 cup of skim milk within the milk group, and 1 slice of wheat bread within the grain group. Then we should account for the 40 minutes of PE class under the physical activity. From this example daily intake, we can estimate our totals and compare to our goal. The diet above had about 4 ounces of grains, and half of them were whole grains, assuming that the items were in fact made from whole grains. There were approximately 1.5 cups of vegetables and about 1 cup of fruit. In addition, the child in our example consumed over 2 cups of skim milk, 2 ounces of meat, and 40 minutes of activity. In our example, the child chose to eat all of the foods offered, and their diet wouldn't be too bad. By eating breakfast and lunch at school, the child would have consumed foods from every food group. In addition, most children also eat at least one other snack and supper at home. Given all this, the child in our example would have been able to meet each goal for every food group. However, the example given is showing an ideal day where most children would likely fall somewhere just below this ideal goal for food choices. As mentioned, the whole grain cereal, the wheat bread, the green peas, the mandarin oranges, the skim milk, and the ham are choices that are more toward the base of the pyramid, while a muffin, a cookie, fruit juice, and potatoes may be more towards the tip of the pyramid. Earlier, we talked about how childhood obesity is soaring and how children's diets do not typically meet all the food guide pyramid recommendations. The point of our activity was to show that school lunch is definitely not solely to blame for this serious problem. As you saw, our sample school lunch provided some whole grains, fruits, and vegetables. The activity also showed you how complex it is to plan a meal that meets all those specific requirements. School lunch is not a terrible thing that is causing childhood obesity. The obesity issue is a complex issue that obviously has many factors. Some of these factors include the activity level of the children, genetics, family lifestyle, competitive foods, fast food, television advertisements, nutrition education, school lunch, and the example set by role models. As you can see, many variables affect the health status of our nation's children. But think about this. The National School Lunch Program provides lunch to more than 31 million children each school day. Schools reach over 95% of all children between the ages of 5 and 17. Obviously, meals at school play a critical role in developing children's eating patterns. They provide 1/2 to 1/3 of many students' daily nutritional needs. It just makes sense to use the National School Lunch Program as a means to show America's youth what a balanced nutritional meal looks like, and what a perfect opportunity to reach the greatest number of America's youth at one time by teaching them nutrition education in the classroom and in the cafeteria, while encouraging physical activity. I'm not necessarily saying that the National School Lunch Program isn't currently doing this. I am confident in saying that there is room to improve the National School Lunch Program, and I know that there is a need for educating the public on current nutrition policy. So let's look at how this program was started. The National School Lunch Act in 1946 created the modern school lunch program. The National School Lunch Program is a federally assisted meal program operating in over 101,000 public and nonprofit private schools. In 2009, it provided nutritionally balanced, low-cost, or free lunches to more than 31 million children each school day. Since the program began, more than 219 billion lunches have been served. Federal, state, and local authorities all play a role in administering and operating the program. The program works by allowing the schools that choose to take part in the lunch program to get cash subsidies and donated commodities from the U.S. Department of Agriculture for each meal they serve. In return, they must serve lunches that meet federal requirements, and they must offer free or reduced-priced lunches to eligible children. Children are eligible for free meals if their family has an income at or below 130% of the poverty line. Children are eligible for reduced-price meals, where they can be charged no more than 40 cents if their family has an income between 130 and 185% of the poverty level. Children whose families have an income above 185% of the poverty level pay the full price, which is set by the local school authorities, but their meal service operation must run as a nonprofit program. The USDA provides support to schools participating in the National School Lunch Program by giving cash reimbursement for each meal served. $2.72 for free lunches, $2.32 for reduced price lunches, and 26 cents for paid lunches. Schools also receive 20 cents of USDA foods for each meal served. Schools can also get bonus USDA foods as they are available from surplus agriculture stocks. USDA has worked with schools to help promote connections with local small farmers who may be able to provide fresh produce. USDA may also assist schools with training for school food service staff and with nutrition education for the children through teen nutrition. The National School Lunch Program cost $9.8 billion in 2009. So, who are the stakeholders? Meaning, who does the National School Lunch Program affect? Well, first and most importantly is the nutrition of our children and their health. Another consideration is the cost to parents. Is an increase in cost worth an increase in the nutrition of the meals? Also, the food service staff. How will their jobs change? And will they be required to undergo additional training or more education? School authorities. Will school authorities be required to meet stricter wellness plans? How will they incorporate this into their curriculum? And how will they afford the cost? Will schools lose out on making a profit by not allowing certain foods in the school? The USDA. What is the most nutritious, most realistic, and affordable requirements for schools to meet? Dietetic practitioners. Do the dietetic professionals need to step up as the nutrition authority? Do they need to be leaders in their community for health promotion? Local farmers. Is this an opportunity to support rural agriculture and the local markets? Could schools get seasonal produce or maybe meat from local farmers? And the food industry. How will stricter guidelines affect the food industry as far as what foods are allowed to come into schools? Will there be a shift in the market demand for foods? As you heard, there are many people that school nutrition legislation affects. And the first act we will talk about is the Child Nutrition Reauthorization Act of 2004, which went into effect for the start of the 2006 school year. This act requires schools that participate in the National School Lunch Program to form a committee with designated stakeholders, including a student, a parent, a school board member, a school food service worker, administrator, and a community member. The goal of the committee was to develop a local school wellness policy addressing physical activity, nutrition education, school-based wellness activities, and nutrition guidelines for all foods available during the school day, including the competitive foods such as vending machines, bake sales, school stores, and a la carte items. A potential problem with the Act is that it is required that all school districts must have a wellness policy, but it doesn't say the policy has to be good. It really leaves the standards up to the local school district. For all we know, it may be the school's goal to have a vending machine in every hallway. Now, some schools may have great wellness policies in place, but there is so much variation from school to school. This may be due to the fact that there isn't really an incentive to having a good wellness plan, nor is there a disincentive for having a bad wellness plan. Iowa tends to implement local control of school districts. Iowa recently passed the Healthy Kids Act in the spring of 2008. The rules were published in the spring of 2009, and it just started being implemented in schools this fall in 2010. The intent of the Healthy Kids Act is to complement the local school wellness policy. Before I said the Child Nutrition Reauthorization Act enforced schools to make a wellness policy, but didn't specify any standards. This is where Iowa's Healthy Kids Act began, and other states have passed similar laws. The Child Nutrition Reauthorization Act is up for revision. It has been proposed that schools with a good wellness policy in place may receive a 6-cent per meal incentive. We may also see a national standard set for competitive foods. If a national standard was set, it would take precedence over Iowa's Healthy Kids Act. But for now, our state's Healthy Kids Act is the only standard for competitive foods we have to follow. The Healthy Kids Act has set a standard for multiple areas of wellness, which are to establish rules for minutes of physical activity on a daily or weekly basis for students, establish rules for nutrition standards for food and beverages sold or provided on the school grounds during the school day. This includes a la carte, vending, and regulated fundraising items. These recommendations do not apply to the school lunch program. The Healthy Kids Act also requires every student to complete a course that leads to certification in CPR and requires area education agencies to contract with one or more licensed dietitians. Iowa's Healthy Kids Act sets nutrition standards for a la carte, vending, and regulated fundraising items. As you can see in the chart, there are specific limits for calories and sodium. Saturated fat can be no more than 10% of calories. Trans fat cannot exceed 0.5 grams per serving. Total fat can make up no more than 35% of total calories. Sugar cannot contribute any more than 35% of total calories. 50% of grains offered must be whole grain. Milk can be low or non-fat, regular or flavored. Milk can't contain any non-nutritive sweeteners. And as you can see, the sugar content allowed in milk will gradually become more strict in the years to come. Fruit juice is allowed, but must be 100% juice and not contain any sweeteners. Water can't have any added non-nutritive sweeteners. Sports drinks, flavored water, and caffeinated beverages are not to be made available to elementary students during the school day, while soda and carbonated beverages are not to be made available to any students during the school day. Schools participating in the National School Lunch Program must comply with specific nutrition standards. District menu planners are encouraged to work toward the 2005 Dietary Guidelines for Americans, but current recommendations are still based on the 1995 Dietary Guidelines for Americans, which lacks some of the updated information about trans fat, sugar, and sodium that has since been made available on the 2005 guidelines. It is surprising that the recommendations for school meals is still based off of the 1995 guidelines, 15 years later. In October of 2009, the Institute of Medicine released recommendations for the National School Lunch Program to adopt a new set of standards for menu planning, which will bring the school meals more in line with the latest dietary guidelines of 2005. The report focuses on limiting sodium, saturated fat, and trans fat while encouraging unsaturated oils. The Institute of Medicine recommendations are as follows. Maximum calorie levels for grades K through 5, 6 through 8, and 9 through 12. To reduce sodium to the target of 740 milligrams per lunch, to serve 1 cup of fruit a day, to serve 3/4 to 1 cup of vegetables a day, and to serve less starchy vegetables while serving more green leafy vegetables, orange vegetables, and legumes per week. To make half or more of the grains whole grain, to serve 1 cup of 1% or non-fat milk at lunch daily, and to serve 2 ounces of meat or meat alternatives on most days. The USDA is currently using the Institute of Medicine's report to make revisions to the nutrient requirements of school meals. Unfortunately, change takes time, and these changes will probably still take another year. The Farm to School program is encouraged as a way to provide students with exposure to fresh fruits and vegetables grown locally. This is also beneficial to the local economy. Those who purchase local foods must ensure an open market approach and that products are produced and handled safely. This program is encouraged by the USDA, but it isn't as simple as it sounds since it has many rules and regulations. Also, it is difficult for a local farmer to supply a larger school with the quantities they need. It may work better with smaller schools. School garden produce can be used as well. Some schools in northeast Iowa have school gardens that supply their school with a variety of vegetables for the salad bar. Schools report a 3 to 16% increase in school meal participation when farm fresh food is served, bringing more school lunch funds to the school. So what are some possible outcomes that are likely to occur as schools adopt stricter nutrition requirements for foods made available at school? Here are a few positive outcomes. Kids may start developing a taste for healthier foods. Children may have improved health, nutrition, and overall wellness both physically and mentally. Children may have better behavior and focus in schools, and we could even see a reverse in the obesity epidemic. And a few negative outcomes may be an increased cost in school lunches, the increased time it will take to prepare the food, students may not like the food, and parents that are resistant to change may be upset. As we mentioned, there are many possible outcomes of adopting stricter nutrition regulations. These outcomes may be positive, but some may be negative. So let's discuss some things to consider. When we are talking about our nation's youth, our number one concern of foods offered in schools should be their nutrition level. We should be asking, how is the food we buy going to make our kids healthier, stronger, and more ready to learn? Rather than asking, what is the most economical way to make our kids full? Spending a little more money for nutrition in schools is an investment in our children's future, especially when you take into consideration the healthcare costs associated with obesity. Plus, well-fed students are shown to have better concentration in the classroom while having less bad behavior. Not to mention the boost in emotional health that comes with kids feeling good about themselves. But unfortunately, money is always a factor, and how we are going to pay for nutritionally higher quality food is something that needs to be considered. Student acceptance is one important yet overlooked piece of the puzzle. It doesn't matter how nutritious a food is unless the kids are going to eat it. But remember that between 5 and 14, repeated exposures to a new food are needed to see increased preference in both infants and children. This is where parents and schools must work together. Parents are the most powerful shapers of a child's early food experiences by deciding eating patterns and what foods are available and in what quantity. It's up to parents and daycare providers to start the children out on a well-balanced diet. Once the child starts school, the school lunch program should follow through and do its part too. Here are some examples of schools putting the recommendations in action. The D.C. Healthy Schools Act passed in May 2010. Schools in that area are trying new foods like hummus, turkey dogs, and whole wheat items rather than the traditional pizza, French fries, chicken nuggets, and corn dogs. The schools have cut trans fat and have put limits on sodium and saturated fat. Some schools are starting to list calorie information on the menu boards, which has many people upset. They say that information has no place in a school where students may internalize dieting at a young age. The menu alterations included cutting chocolate milk, which left many people upset as well. According to the National Dairy Council, flavored milk is a nutrient-rich beverage that is good for kids. Offering flavored low-fat milk or fat-free milk is an excellent way to increase milk consumption among children and make their diets more nutritious. Offering flavored milk can help increase milk consumption and actually boost overall participation in school meal programs. Limiting access to flavored milk because of its added sugar may have undesirable effects of reducing intakes of essential nutrients provided by milk. Kids who consume flavored milk meet their calcium requirement without consuming significantly more added sugar compared to those who do not consume milk. Flavored milk drinkers have lower intakes of soft drinks compared to those who do not drink flavored milk, and flavored milk drinkers drink more milk than unflavored milk drinkers. Milk drinkers in general consume more calcium, phosphorus, magnesium, potassium, and vitamin A than non-milk drinkers. Flavored milk drinkers do not have higher total fat or calorie intakes than non-milk drinkers, and the children who drink flavored milk and unflavored milk don't have higher body mass indexes than those who do not drink milk. So, according to this, adding a small amount of sugar to a nutrient-rich food such as milk helps improve nutrient intake without adding excessive calories. In September, there was an article on the ISU College of Human Sciences homepage about an Iowa State alum who earned a national award for school nutrition services. Mary Kate Harrison is the general manager of student nutrition services for the school district in Florida. When she started at the school district 20 years ago, they were operating with an annual loss of $2.2 million. Within 4 years, Harrison had overcame the challenge and had changed the district's meal program to generate a $3.4 million profit. She runs the lunchroom more like a restaurant in the sense that the students are their important customers that they have to reach, rather than just assuming that the students have to be there, which allows you to give them whatever you want. This approach has shown to generate really good participation rates in her district. The better menus and the better overall experience got more kids eating a nutritious school lunch. Harrison's nutrition managers are required to complete an 18-week internship before they are hired. All nutrition staff are required to undergo ongoing training. The school makes nutrient-dense food made with quality ingredients one of their top priorities. The lunch costs $2.75 per student, and they offer more whole grains, made from scratch cooking, and locally grown produce. Harrison says that getting kids to eat their fruits and vegetables is all in the marketing and presentation. Some ways her school makes food appear attractive include sprinkling cheese over broccoli or serving salads in the same black bowls that fast food restaurants use. Harrison strongly believes that well-fed students will have more energy and a better attention span to learn. So this example goes to show that it is possible to implement the nutrition recommendations for school lunches. In summary, childhood obesity is on the rise, with 32% of children between the ages of 2 and 19 overweight or obese. Research shows that overweight children are likely to become obese adults. When we look at our children's eating habits, it is evident that improvements can be made. Only 2% of kids meet all Food Guide Pyramid's recommendations. We understand that there are so many factors contributing to poor nutrition in our nation's children. The goal with this presentation was to help you recognize that school is a great place to start making improvements, since school is where the kids are. Making changes in our schools is a complex and slow process affecting many people. Some of the current laws include the Child Nutrition Reauthorization Act that makes schools put together a wellness policy. The Healthy Kids Act is a law in Iowa that clarifies what standards we need to meet regarding competitive foods. The National School Lunch Program is currently required to meet the 1995 Dietary Guidelines, but the USDA is currently revising the recommendations to meet the Institute of Medicine's report, which will be more in line with our current 2005 guidelines. I hope this information will help you feel that you can make a difference. I hope you are now more informed of the school nutrition policies. Get informed about your own school's policies and communicate with the kids you know about what they are choosing to eat at school. Be active in your communities. For example, should a convenience store or a fast food restaurant be allowed to build across from a school? Or does your city have any fitness trails that have become unusable? These are community issues. Also, contact your legislators. School nutrition is a political activity, and who is in Congress makes a difference. Let them know your views and your concerns. Last, I want to remind you that you are a role model. Whether you are a parent, a grandparent, a staff member, a coach, or a peer, people watch what you do. Are you setting a good example by the lifestyle choices you make?